By the end of December, we expect to have about 40 million doses of these two vaccines.
Some African Americans won't be rushing to get those vaccines. This is part of a conversation happening on social media.
I'm not confident at all in our government because the government is, again, not for Black people.
A doctor at UAMS says the skepticism makes sense.
Their thoughts and their fears are understandable. Our health system has failed African Americans in the past, and most notably, we think about, the Tuskegee trials back in the 1930s.
Where African American men were used unknowingly to test syphilis treatments, resulting in them infecting their wives and deteriorating their health over time.
Why not figure something else out without using Black humans and sacrificing us as the guinea pig?
A lot has changed since the 1930s when we do think about the past, and when it comes to any healthcare, any medication or vaccine or anything that's going through clinical research trials, the process is heavily vetted and very strict nowadays.
Doctor, even after 88 years with the Tuskegee experiment, and even with those comments today, what do you say to people who are still skeptical?
We take an oath to do the best, to do no harm to our patients, and that's every single patient, regardless of where you're from, your background. But we want to make sure that this vaccine works in all groups of patients and that it is safe before we do distribute it to the general population.
Jade Jackson, THV 11 News.